Welcome back, everybody. With COVID-19 now a part of our daily lives, some people may still have questions, whether it be, should I get the vaccine or what's the right amount of dosage?
Yeah, there's a lot of questions, which is why we talked to our friends at Kalihi Palama to get you informed and what they're telling their clients.
The start of the COVID-19 pandemic was years ago. It's now nearly the end of 2023, but not the end of the pandemic as numbers continue to rise. So we decided to come to the Kalihi Palama Health Center to learn about the latest recommendations. And I'm joined by Dr. Walter, who's going to be giving us those. Aloha.
Welcome here.
Thank you, and thanks so much for having me. Now, I think a lot of people, we kind of got worn out from hearing all about it and now hearing that less people are dying from it. I think people are a bit less scared, masks are off, people are traveling. But what are the latest recommendations? Because the pandemic's not over.
Sure, it's not over. Well, the recommendations are that everybody 6 months old or older should receive the updated COVID-19 vaccine. If you've already finished your vaccine series, you've already vaccinated for 6 months and above, you only need 1 dose to be up to date. If you're not vaccinated, if your kids are 6 months to 4 years old, they haven't been vaccinated yet, they may need 2 or 3 doses depending on which vaccine they choose. If they're 5 and over and you haven't been vaccinated yet, only 1 dose and you're up to date and fully vaccinated.
And speaking of the current COVID, it did change from when we first saw, the Delta come out. We are hearing of less people dying. It seems less aggressive. I don't know if that's the correct term, but, if that's the case, do we really still need to get the shot?
It is. COVID is milder than the original strain we saw and the Delta variant that hit in 2021. But it's still very deadly and very, very contagious. So since January 2022, when Omicron took over everything, we've had 3 times as many deaths in pediatric deaths from COVID compared to flu.
Okay, and let's talk about, the naysayers that have, and people that are really into some conspiracy theories too. You've heard that, it's just big pharma. Some people even claim COVID's not real. What would you say to some of the naysayers that have all these different theories?
That skepticism that comes from a healthy skepticism of big government and big programs, especially when the big government partners with big massive pharmaceutical companies, and it does raise suspicions. But the vaccines that we have now, they have very deep roots in public health, community medicine. Some form of vaccines have been in place for hundreds, maybe thousands of years. And through centuries and decades of research and work and basic science understanding is what's led us to the vaccines we have now. So they have those deep public health roots. And the vaccines, study after study shows that the vaccines are effective in helping to helping to protect pregnant women and their unborn children, protecting young children, healthy adults with comorbidities, and elderly. So the vaccines are very effective. There are a lot of eyes watching COVID and the vaccines, and so we do need that independent oversight for the government and the pharmaceuticals, and we have working hard to make sure we get the message out that it is real and these vaccines are effective.
And there are a lot. So, when it comes to COVID and RSV and all the others that parents need, how do you help with vaccine anxiety that a lot of people have?
Sure, and it's natural, you see parents doing the math in their head when you tell them how many shots the kids need, and so it can be anxious for parents. So again, my role is to give them the information, help them to make the safest decision they can. And one of the issues is that these diseases are not in the public eye anymore. A lot of the ones that we treat for, if we were having this discussion 100 years ago, 1923, which is not that long ago, we wouldn't be talking about vaccines as much. There weren't very many available at that time. We would be talking about how, in Hawaii, the infant mortality rate was about 16%. That means about 16% of all live-born children would die within the first year of life in Hawaii. Now that rate is less than 1/2%. So the reason most of those kids died at that time was because of infectious diseases like diarrhea and pneumonia. A lot of those diseases, they're not common knowledge now, and that's because of vaccines, because of public health efforts like clean water, safe food, sanitation, access to healthcare, and vaccines. So vaccine is a pillar of that. So
when it comes to the recommendations for everything then, especially as we're approaching winter, what do you recommend?
So I think, make sure that you're up to date on your vaccine. Besides the COVID vaccines, there are the new RSV vaccines. There's also the flu vaccine is still available. So make sure you're up to date on your vaccines. Being careful if you are feeling sick, stay home, do your COVID test. And if you're traveling, wear your mask. If you're not feeling good, don't go out, stay home, and make sure washing hands and things. And then, but just to make sure doing those things can help make the holidays brighter.
And don't forget to wash your hands. I feel like that was something that we pushed out a lot during the pandemic, but that's still relevant. Okay, so stay clean out there. And then if you want to learn more information, the website?
www.kphc.org.
Perfect. And we'll have that on our website at k22.com. Thanks so much for having me on
Thank you
here.
very much.
All right, back to the studio.